Morning, I'm Dr. Hiba Ghannoum, and our lecture today is disease of the external ear. What are the different conditions that might affect the external ear? These might be congenital, inflammatory, traumatic, or neoplastic. What are the congenital anomalies of the auricle and the external auditory canal? These might present as a defect in shape, as in anosia, microtia, and macrotia. Anosia is the absent auricle. Microtia is the small-sized and deformed auricle, and macrotia is a large-sized auricle. What about the bat ears? The bat ears are prominent ears. Another congenital anomaly is the accessory auricle, preauricular sinus and cyst, and finally the atresia of the external auditory canal, what we call congenital meatal atresia. Let's take a look on these photos showing the different anomalies of the external ear. Here the anosia, absent auricle, microtia, small and deformed auricle. We have here the bat ears, the prominent ears, cup-shaped ears. Another photo showing the anosia, the absent auricle, near the microtia. Another photo here showing the microtia together with the congenital meatal stenosis and preauricular sinus. Regarding the macrotia and the bat ears, they are usually not accompanied by any functional abnormality. They just need, it's just a cosmetic problem that needs correction by plastic surgeries. Another group of photos for the congenital anomalies of the external ear, the bat ears, the prominent ears, the accessory auricle, and another photo for the accessory auricle. Again, these deformities, they just need plastic surgery to correct the cosmetic appearance in case it's bothering the patient. The only point is you have to check whenever you find a congenital anomaly, make sure it's the only anomaly present. What about the preauricular sinus? It's a small opening anterior to the root of the helix. It's usually unilateral but might present bilaterally. The clinical picture of the preauricular sinus, in most cases it's asymptomatic and it can stay asymptomatic. In some cases recurrent infection occurs and this causes pain, tenderness, edema, and purulent discharge from the opening of the sinus. If the edema causes this opening to be closed, then the secretions or the discharge will be collected inside, causing an abscess. Treatment of preauricular sinus. If it's asymptomatic, then no treatment is needed. During infection, the patient will be prescribed antibiotics and surgical drainage is needed. As you can see here, this photo is showing the infected preauricular sinus with the purulent discharge. If the infection is recurrent, then excision will be required, a microsurgical excision. And this is a minor operation, but it has to be done very accurately with complete excision of the whole sinus, otherwise recurrent will occur, and that's why we use a dye, inject a dye inside the sinus, methylene blue dye, to help during this operation for the complete excision. Congenital meatal atresia is failure of canalization of the external auditory canal due to a defect in the first branchial arch. It might present bilaterally or unilaterally, and it's usually accompanied by other congenital ear anomalies like anomalies of the auricle, like the microtia, or anomalies of middle ear like hypoplasia or aplasia of the middle ear. It's rarely accompanied by inner ear anomalies. That's because of the different embryological origin. There are different grades for the congenital meatal atresia, ranging from meatal stenosis to complete atresia. The clinical picture of meatal atresia is conductive hearing loss. Sometimes it's mixed hearing loss if it's accompanied by inner ear anomalies. What are the investigations needed for a case of congenital meatal atresia? Number one, CT temporal bone. Why do we need CT temporal bone? Because, as I mentioned earlier, there are different grades of atresia. So in each patient, I will need to assess the degree of the atresia. Also, I need to assess the presence or absence of any other deformities, whether in the middle ear or the inner ear. Number two, I need functional assessment of hearing sensitivity. So as this patient is always an infant or a child, I cannot rely on the subjective method of hearing assessment. I need another method which is called the auditory brainstem response, ABR. What is ABR? ABR is an objective method of hearing assessment where we give a stimulus to the child and then we record a response by electrodes placed on the skin. This is called evoked potentials, and we'll know more about the auditory brainstem response and the hearing assessment, the methods of hearing assessment later on. Now we come to the treatment of congenital meatal atresia, and this will depend on whether the case is unilateral or bilateral. In unilateral cases, plastic surgery can be done for cosmetic reasons, but in unilateral cases, note that it's very important to check that the other ear has normal hearing. Why do we need to check that the other ear has normal hearing? Because this is very important for the normal speech and language development of this child. What about bilateral cases? In bilateral cases, we need amplification with bone conduction hearing aids as soon as possible, as early as possible. We need to fit this child with bone conduction hearing aids to allow for the acquisition of speech and language. The operation, the plastic surgery, will be done at school age, and in case there is the meatal atresia is accompanied by microtia, we usually correct the microtia first and then the atresia, the canal atresia. So we do the auriculoplasty first and then it's followed by the canaloplasty. Now that we're done with the congenital anomalies, we move on to the inflammatory conditions of the external ear. Inflammation of the perichondrium of the auricle is called perichondritis, whereas inflammation in the external auditory canal, we call it otitis externa. Perichondritis of auricular cartilage is the inflammation of perichondrium of the auricle. What are the causes of perichondritis? It can be caused by infected hematoma or laceration caused by a trauma to the auricle, or an infected surgical incision, or a furuncle if we squeeze it. What is the furuncle? It's an inflamed hair follicle. So if we squeeze this furuncle, the inflammation will reach the perichondrium, causing perichondritis of the auricle. What's the clinical picture of perichondritis? The symptoms, the general symptoms of inflammation, as usual, fever, headache, anorexia, and malaise. What about the ear itself? The auricle will be swollen and painful. Upon examination, the signs. What are the signs of perichondritis? On examination, we'll find the general sign as well as fever. The ear, the auricle will be swollen, reddish, hot and tender, and the lobule will be free because there is no cartilage in the lobule. What are the complications of perichondritis? In case this inflammation is not properly managed, this will end in cartilage necrosis causing fibrosis, a condition which is known as cauliflower ear. As you can see here, in this photo, a deformed auricle known as cauliflower ear. What's the treatment of perichondritis? Antibiotics and analgesics, drainage and debridement. What do we mean by debridement? It's the removal of any necrosed cartilage. Otitis externa is inflammation of the skin lining the external auditory canal. This can be either diffused or localized. Diffused will be divided according to the causative organism into fungal, viral, or bacterial. Bacterial can be either the diffuse otitis externa or malignant otitis externa. Also, the localized is called furunculosis, and it's also bacterial, caused by Staph aureus. We'll now start with the localized type of otitis externa, what's known as furunculosis. It is a suppurative infection of the hair follicle in the external auditory canal. Hair follicle يبقى معناها هتبقى located in the outer 1/3 ولا inner 2/3, as we earlier mentioned in the lecture of the anatomy in the previous lecture. The outer 1/3 هو اللي فيه الhair follicle والsebaceous glands والceruminous glands. يبقى furunculosis will always occur in the outer 1/3 of the external auditory canal. It's caused by the causative organism is Staphylococcal aureus. Clinical picture of furunculosis symptoms: severe pain that increases with mastication and on moving the auricle. ليه severe pain? Because the skin is adherent, as we earlier said, to the perichondrium, and there is no place for the inflammatory exudate, so it causes severe pain. Another symptom is hearing loss. Hearing loss will only be present in case the external auditory canal is occluded by this furuncle. What are the signs? Upon examination, we'll find it's very tender on pulling the auricle or pushing the tragus. Preauricular and or postauricular lymphadenitis. This will be in the form of preauricular or postauricular swelling can be present. Also, scanty purulent discharge can be present in case the furuncle ruptured. What are the predisposing factors to recurrent furunculosis? The most important thing is diabetes mellitus. We have to exclude, in case of recurrent furunculosis, we have to exclude diabetes mellitus. Also, recurrent skin lacerations, either caused by scratching the external auditory canal by an earbud, or during ear wash or instrumentation inside the ear canal. How do we treat a case of furunculosis? We prescribe antibiotics for the inflammation, analgesics for the pain, a pack of glycerine ichthiol, Y glycerine, to reduce the edema, and Y ichthiol to reduce the pain. This is packed, goes with glycerine ichthiol is packed in the external auditory meatus. Incision and drainage are rarely needed in resistant cases that does not respond to treatment. Now, the first type of diffuse otitis externa, the fungal type, what's known as otomycosis. What is the causative organism? It's Aspergillus niger and Candida albicans. What is the clinical picture? First, the symptoms. The main symptom is severe itching in the external auditory canal, in addition to hearing loss and pain, especially if the hyphae are occluding the mass, the fungal mass is occluding the external auditory canal. On examination, what will you see in a patient of otomycosis? You will see a mass looking like a wet newspaper with white and black dots taking the shape of a wet newspaper. How do we treat a case of otomycosis? First of all, remove the fungal mass from the external auditory canal, either by washing and drying, or better, avoid washing, avoid water, and use suction. Then an antifungal treatment is prescribed. in the form of ear drops as nystatin, antifungal ear drops as nystatin or clotrimazole, or 2% salicylic acid in alcohol, which is keratolytic and fungicidal. Why would we need this? Because sometimes the fungus is deeply embedded in the epidermis of the external auditory canal. In resistant cases, we use a pack with antifungal cream on a piece of gauze. Viral otitis externa can come in three forms. First, by herpes simplex, we can see vesicles on the external auditory canal and the lips, and this usually happens in cases of common cold. Bullous myringitis, these are bulli that can be seen on the outer layer of the tympanic membrane. Bulli filled with serous fluid and can be seen on the outer layer of the tympanic membrane. And the third form of the viral otitis externa, what's known as herpes zoster oticus. This is caused by herpes zoster, chickenpox. It's a viral infection of the skin covering the auricle and the skin of the external auditory canal, and it is characterized by severe earache and serosanguinous discharge when these vesicles rupture. Herpes zoster virus can extend to affect the geniculate ganglion, causing facial palsy, and extend to the 8th cranial nerve, causing sensory neural hearing loss and vertigo. This triad, the herpes zoster oticus, together with the facial nerve palsy and the sensory neural hearing loss and vertigo, we call it Ramsay-Hunt syndrome. What is the clinical picture of Ramsay-Hunt syndrome? Vesicles on the external auditory canal and the auricle, otalgia, severe otalgia, together with lower motor neuron ipsilateral facial nerve palsy, sensory neural hearing loss and vertigo. This is called Ramsay-Hunt syndrome. How do we treat the Ramsay-Hunt syndrome? Analgesics for the pain, for the severe otalgia, and antiviral drugs. In severe cases, we prescribe corticosteroids. How do we define diffuse otitis externa? This is diffuse inflammation in the skin lining of the external auditory canal. What are the predisposing factors to diffuse otitis externa? Same as those of pharynculosis, both are bacterial infections. Just one is localized and the other is diffuse, but they have the same predisposing factors as we said before. The most important predisposing factor is diabetes mellitus, scratching of the external auditory canal, swimming in an infected pool, excessive sweating, and seborrhea. If you want to recall them or remember these 5 S's, scratching, swimming, sweating, seborrhea, and sugar for diabetes mellitus. Clinical picture of diffuse otitis externa, same as pharynculosis. The symptoms: pain that increases with mastication and scanty discharge. Hearing loss and tinnitus occurs only if the edema is severe and occludes the external auditory canal. What about signs? What will you find when you examine a patient with diffuse otitis externa? Diffuse redness and edema, and swelling of the external auditory canal. Also, you will find the swellings, the pre and post auricular swellings from lymphadenitis. What are the investigations needed for a case of diffuse otitis externa? For recurrent cases of diffuse otitis externa, definitely we have to exclude diabetes, again, the blood sugar. And this is different than pharynculosis, because in pharynculosis we don't need culture and sensitivity, as we know the causative organism, the Staph aureus, But in cases of diffuse otitis externa that are resistant to treatment, we can make use of the culture and sensitivity from the discharge. How do we treat a case of diffuse otitis externa? Systemic antibiotics for the inflammation and analgesics to reduce the pain. Suction or dry mopping to remove the discharge, and ear drops containing antibiotics and corticosteroids. Malignant otitis externa is a serious condition. It's an invasive bacterial infection that is caused by Pseudomonas. It affects the skin lining of the external auditory canal, and it also extends to the base of the skull, causing bone erosion. This condition usually occurs in old-aged patients who have uncontrolled diabetes. What is the clinical picture of malignant otitis externa? Symptoms same as diffuse otitis externa. Starts with pain, hearing loss, and tinnitus, except that the pain is severe and does not respond to any treatment. What are the signs upon examination that you can see? In the external, on the floor of the external auditory canal, you can see granulation tissue caused by the bone erosion. You can see discharge, otorrhea, purulent, sanguineous, and scanty. Also, facial palsy and other cranial nerves can be affected, especially the last 4 cranial nerves that can be affected at the jugular foramen, and this is considered a bad prognostic sign. Investigations of malignant otitis externa. First, we ask for a CT scan for temporal bone and base of the skull. Radioisotope studies, the gallium and the technetium, are done to assess the severity and the prognosis of the infection. A biopsy is taken from the granulation tissue in order to differentiate it from any malignancy. And finally, culture and sensitivity can be done from the discharge to diagnose the Pseudomonas, the causative organism. Treatment of malignant otitis externa, as we mentioned, this is a serious condition. It needs hospitalization and control of diabetes. It needs systemic and local antibiotics. Systemic antibiotics by combination of ciprofloxacin and cephalosporin, and local ear drops as ciprofloxacin. Surgical removal of the necrotic tissues will rarely be of value. Now we are done with the congenital and inflammatory conditions of the external ear. We move to trauma to the external ear, hematoma oris, lacerations, and tympanic membrane perforation. We will postpone tympanic membrane perforation to another lecture. It will be discussed with middle ear, trauma to the middle ear. Hematoma oris is a collection of blood in the auricle between the cartilage and the perichondrium. It is either caused by a direct blunt trauma to the auricle, what's called boxer's ear, or it can occur spontaneously, as in cases of hemorrhagic blood disease. The clinical picture will find, as you can see in this photo, cystic painful swelling. What are the complications of hematoma oris? As we earlier said, in perichondritis, this collection of blood, the hematoma, can cause necrosis to the cartilage, which will end in fibrosis and causing the cauliflower ear that we mentioned earlier. How do we treat hematoma oris? In case the blood is still not clotted, this blood is aspirated, and in case it's clotted, then we need to make an incision and evacuate the hematoma, and then apply a tight bandage to prevent recollection again of blood, with prescribing the suitable antibiotics. Sharp trauma to the auricle can cause laceration. This can be caused or induced by any sharp object like a knife, or by a bite or pulling of an ear ring. What is the clinical picture of laceration? You'll find pain and laceration of the skin with or without the involvement of the cartilage. And in severe cases, we can even see partial or complete avulsion of the auricle. How do we treat the lacerations? We prescribe antibiotics and we do suturing and repair of the auricle. Foreign bodies in the external auditory canal. With any foreign bodies, we need to mention two very important points. What is the type of patient and what is the type of foreign body? Type of patient here is usually a child or might be a mentally retarded adult. Type of foreign bodies is divided into animate and inanimate. Animate can be an insect, anything like a fly, a mosquito, a cockroach, and this causes severe irritation and noise in the external auditory canal. What about the inanimate? The inanimate can be either vegetable or non-vegetable. We divide it into vegetable foreign bodies and non-vegetable foreign bodies. The vegetable foreign bodies as seeds, and non-vegetable foreign bodies can be buttons, beads, piece of paper, cotton buds, anything. What are the symptoms of foreign body in the external auditory canal? Believe it or not, many times it's accidentally discovered. It is asymptomatic. In other cases, it might cause hearing loss and tinnitus, especially if it's occluding the external auditory meatus. And in case, as we mentioned earlier, in case of a mosquito or a cockroach, animate foreign bodies, they cause severe irritation and noise sensation in the external auditory canal. Complication usually occurs due to unskilled management, especially during removal of the foreign body. This can be injury to the external auditory canal or perforation of the tympanic membrane or infection of the external auditory canal, otitis externa or otitis media from the perforation. Treatment will depend on the type of foreign body. If the foreign body is animate, then we'll have to kill the insect first by drowning it in alcohol or in oil, and then removing the insect either by ear wash or by a suction or fine instrument. What about cases of non-animate foreign body? If the non-animate foreign body is a vegetable, like a seed, avoid using water. Why? Because if we use water, the vegetable will swell inside the ear canal and get more impacted. So with vegetable foreign bodies, remove it either by a hook or by suction. What about if it's non-vegetable? We can either do ear wash or remove it by a hook or a suction, whichever is more accessible. Please note that if we are dealing with a child or a neurotic adult that cannot stay still while removing the foreign body, then go for general anesthesia. The other thing is, if the foreign body is impacted and all the measures, the previous measure fails, then we can remove the foreign body by a post-auricular incision under general anesthesia. Earwax is composed of the secretions of the sebaceous and the ceruminous glands that are present in the outer one-third of the external auditory canal. It has a protective mechanism and protective function, and it is usually cleared spontaneously through the epithelial migration. Clinical picture of earwax. Wax will only cause symptoms of hearing loss, tinnitus, and pain only when it completely occludes the external auditory canal. This usually can happen all of a sudden after a bath or after swimming. The patient will then complain of a sudden sense of occlusion or sudden diminution of hearing following swimming or following taking a bath. Upon examination of this patient, you will find a brownish mass occluding the external auditory canal. How do we treat wax? This will depend on whether this wax is soft or hard. If this wax is soft, then immediately we do ear wash If it's hard, we just prescribe glycerin bicarb ear drops to the patient to soften this wax. Then after this, we do the ear wash. So let's quickly sum up what we have said so far. We mentioned the congenital, inflammatory, and traumatic conditions that can affect the external ear, in addition to foreign body impacted in the external auditory canal and ear wax. Now we move on to the neoplastic conditions that can affect the external ear or the tumors, but I will just mention them for now because there is a whole lecture that will deliberately explain the tumors of the ear, and they will be mentioned afterwards. So tumors of the external ear can either be benign or malignant. Benign is called exostosis. Malignant can either be a basal cell carcinoma or a squamous cell carcinoma. And I will stop here for now, wishing you all the best of luck and waiting for any questions.